development, and also doing a lot of research about how to build educators' identity. And hopefully by knowing what constructs the identity of an educator, we are then able to help our educators to be more interested in medical education now. So that's why this studies at the workplace, like the social constructs, the context that the clinician is, and how it will help or hinder the educator identity development. Okay, so because we don't want this to be like a lecture, right? So we have a little bit of interaction. So we hope that you can also cooperate with us. So we'll launch a little poll now to actually see like which of the disciplines that you are from, so that we can also contextualize the talk to all of you. So for this, are you a surgeon, physician, nurse, AHP, or others? So we want to try to get to know you all a little bit better through this poll. Okay, so I see that we have a lot of nurses, so thank you for attending. Yeah, so we appreciate, because you're also very, very busy, right? But to come here. So we hope that, you know, in this light of wherever you're working in the workplace, it will be relevant for you. Okay. So maybe you wait. I think most people have responded already, so I'll just end the poll. So yeah, I think most of us are really from our nursing colleagues. So thank you for coming. We have one AHP, one other, and one physician here. Can I check who is the other? And if you don't mind sharing, like, where are you like from, and what do you do in the healthcare? Yeah. If you don't mind sharing, you can just unmute yourself. Yeah, or if you want to open the camera, that's fine as well.
Hi, I'm Pei.
Hello.
I'm from National Dental Center. So I'm a dentist by training.
Okay, thank you, Pei Yuan, for coming. So I guess in dentists, they are quite aligned with the surgeons, right? Do you agree or not?
I think it really depends on the field that you are in. So like, for example, if you are oral surgeon, then you would do a lot of surgeries. Whereas if you are like orthodontist, you probably wouldn't do like surgeries. It will probably be quite a dry and clean field.
Oh, okay. I wouldn't think dry and clean. We all need your help also, right? For our health, yeah. So I guess, but you're more procedure based, right? I suppose. Okay, but never mind. Later we can ask a little bit more about your culture. Okay, we can move on to the next slide. So why this paper again? So thank you everyone for responding. Yeah, next slide, please. So when we talk about professional identity, right, what does it mean, right? So professional identity is who we are, who we believe we are. And this is very important because it's like our identity, right? So it's essential, like we know who we are so that we can grow and be competent in what we do, especially in the professional practice as well. So not only having that identity gives us a source of meaning, and it helps us to prioritize and organize our elements and our workplace to see like, oh, if we are teacher, then probably perhaps we should, prioritize teaching. If we feel that we are totally clinician, then to prioritize clinician. So it helps to also prioritize. And in terms of educator identity, right, if you are strongly identified with teacher identity, it has been shown that a key identity for teacher excellence is to one with have this teacher identity who is always striving to excel and provide the best quality of teaching. And that's why all these studies about professional identity came about. So then perhaps we can ask you all, right, like what, for the next slide, what does professional identity mean to you? Sorry, if you don't mind, can I go back to Pei Yuan again to share, like how maybe you can share like your role and how who do you see yourself? Do you see yourself a clinician? Maybe describe your roles first, like, or maybe fully clinician, like doing dentistry stuff, or do you teach, or like admin? Yeah.
I would probably see myself mainly as a clinician, but at the same time, I also play multiple roles. I teach as well as do research and also do some admin. So I guess in terms of the identity, we do a mix of everything. Yeah, but mainly clinical.
Mainly clinical. Okay, thank you for sharing. Maybe we can get somebody else or whoever will volunteer first. If not, we will volunteer some people. Yeah, I think this is important because, knowing your identity in the context, right? Anyone to volunteer? If not, can we invite Karen Kylie from CGH Nursing to share about your professional identity? Thank you.
Hello, everyone. Just give me a while, yeah.
Yeah, it's okay.
Hello,
thank you so
hi.
much.
I'm from CGH Nursing, Nursing Aviation.
Mhm.
So basically, my job is to guide the student when they come for the attachment, nursing students. Yeah, and also as well as I'm also have the chance to guide junior nurses when they are coming in to assimilate them to the ward also. Yeah, so what does professional identity mean to me? I guess is a title that we are being recognized, and also that it also encompasses a lot of things that we can do, which is educate, inspire, yeah, and also to impart the knowledge into the younger ones. And my senior used to tell me, why just be one you when you can actually educate so many more you, and then like just multiply and multiply. Yeah. So that would be my answer.
Thank you. Thank you so much. Very inspiring indeed. Got a lot of pearls of wisdom there. But also like it also shares, right, with all of us that compared to clinician, right, like dentistry, medicine, right, you can see that actually the nurses clinical educator pathway is really more clear, right? So they do really more teaching and they focus on that, and then they have less time for clinical work. So yeah, thank you for sharing. Maybe we can get somebody else from the allied health to share, maybe. Anyone from Allied Health here? We have one, right, from Allied Health, but I don't know who because he's anonymous. No, Allied Health or Allied Health friend? No. Or maybe can I ask Hui Luan, what do you think about your professional identity? Hui Luan? So she's away. Okay, maybe Eileen?
Yeah, it's just such a small group. Journal club is meant for, we all see each other and then have a discussion. Okay.
Okay. Or Hui Luan is using corporate desktop. If you don't mind, you can actually use the text box. So yeah, by the way, like if you all want, you can use the chat box as well.
Yeah.
Thank you. Because we don't want it to be so boring. Yeah, Eileen can share. Yes, thank you. Then Hui Luan can type in the chat box while waiting.
Hi, so actually an APN and I work for anesthesia. I would say that about half the role is actually clinical and the other half is actually education. So yeah, so I think my professional identity is half like split personality.
Okay, thank you for sharing. So you can have quite a delineated role also, right? So I think our nursing colleagues really do have a delineated role. How about Hui Luan? You want to type in the chat box? Yeah, you can type in the chat box. Then maybe we can move on to the next question that we want to ask. How do you think that the next question, the next slide? Yeah. Then maybe Hui Luan can type in the chat box. So wondering like how is your professional identity formed? Because you all mentioned that nursing, is it from your title or is it like someone, and then Karen was sharing that her identity was actually perhaps encouraged by her mentor, right? At that time when she said that, why can have only one you when you can have so many people? So yeah, so that's really very inspiring. So any other input and thoughts about, just to share how was your professional identity formed? Yeah. Anyone inspired you, or is it a workplace? Yeah. Yeah, so meanwhile, I can read Hui Luan's input, which is she sees herself as a nurse educator, which is the professional identity. So maybe just to inspire, like also to share my own personal identity formation, right? So I was actually very inspired to be a clinical educator because since medical school, I was being mentored by really great, awesome teachers. And without them today, right, actually, I wouldn't be, sitting in front of you because they are the one who taught me. They are the one who imparted their knowledge to me. And so when I like grow up, they say, right, when I started working, I felt that I had this very strong calling to again pay it forward to the next generation. And of course, in the same vein also, right, the next generation will be the one looking after us, right? So you invest today, invest in the now for the future, right? They always say that. So that was my main takeaway in towards being a clinical educator. Other than that, for me also, I was formed because I was very interested in teaching. I feel that it's very fruitful that in teaching, the students challenge me. So I cannot be in my comfort zone. I always have to read, and then also have to learn to be humble. It's also a lot of character building, I would say. Yeah, because the students will challenge you, right? So, how do you, even as a senior, right, must humble yourself and to perhaps, admit your own mistakes and limitations. So in other way, like for me also that when I teach students, right, I realize that I don't need to revise, sometimes like if you're very out of touch, like I'm internal medicine, right, to be honest, I forget a lot of my eye things, or like surgical things really. But, teaching students, because I have to repeat the same thing again, it kind of like enforce and remember my knowledge Yeah, so that's my own personal sharing. So if you all have any sharing, just please feel free to share. And then I think Chaoyan has another question. Do you all think professional identity is important? You all can use the chat box also. Yeah. So anyone else can share also how their professional identity is formed? Yeah, don't worry, no judgment. This is more of a sharing session, and then there's no right or wrong answer. Yeah. Feel free to use the chat box as well. Oh, Chaoyan, you want to share why you become all the way from States, right? Why do you want to do this?
Maybe let's share the article first.
Okay, sure.
All the sharing later part, and then
can, no problem.
Do the warm up with the information they're going to share. How about that?
Okay, can, no problem. So we went there already.
Thanks, Deanna. I will share why. I'll try to get the screen here. Hope to see some of you, but anyway, okay. So coming back just now, I put the question in the chat box, right? To be honest, when you hear about professional identity, probably it's quite rare. Only when you came to look through some of the healthcare education articles, so this terminology may came up. But then Deanna explains, why professional identity is super important. I'm not sure. I want to hear from everyone later on. Are you convinced that this is one very important part, for the juniors to become the very good, competent healthcare professional? Okay, so you can keep the question in your head and then think about it, and then we can discuss more later. But anyway, so I want to explain why, the team of the researchers, they did such a study. I mean, the first thing, for the field, for the healthcare profession in the field, overall, the direction it is professional identity, it is very important. Although the lay people, for many of us, you're convinced or not, I mean, that's a different story. I mean, one example I can see, like for medical school, right? The beginning, they have the white coat ceremony. That's one way of helping the students to build the identity to become a medical doctor. So similarly, nursing, allied health, there are some similar ceremony too. So these are all ways of trying to help the students to build the identity. Okay, so coming back to this study, I mean, this is a very important topic, but not much research was done talking about the social cultural aspects, how these components affect the individual's identity formation. So that's one of the reasons why they do this study. On the other hand, like AMEI, one of the major mission is to do all kinds of faculty development programs. So overall, I'm now talking about AMEI globally. In the health profession education field, majority of the faculty development program actually are not that effective in the sense of when we look, how much they learn can be transferred to the actual day-to-day teaching. So it's actually not that effective. So that's a reason why, and then a team of researchers, they say, okay, we want to do the study to see whether this is going to help us to address some of the questions here. Okay, let me see. There is someone in the chat box, Deanna say, don't worry for all of you, it's lunchtime, thanks for joining. If you have to eat, and then please, feel free, go ahead, okay? So that's a reason talking about this study. So what exactly this study about, So the team of the three of them, basically they study the culture in surgery and internal medicine, and then to see how different the culture, for the two specialties, and then how they affect the clinical educators as well as learners, their identity formation. Okay, so I will throw in some of the theory part. I don't know how many of you, you're familiar with healthcare education research and then qualitative research methods. Anyway, so when we do such a type of research, one of the very important questions we always ask, what's your theoretical framework? What does this mean? I mean, basically, it's like, what's a theory you are using to guide your research? Okay, so for coming back to this study, so the overarching theory here is called sociocultural theory. I think, all of us are educators here. You probably have heard about this theory before, one way or another. But what exactly this means, sociocultural? If you don't want to look at the text, you see the bottom part, right? I have the graph here. So when we talk about, one person, the development, the growth, and then, so the important aspects, traditionally, we're all quite familiar when we talk about someone, look at a child, right? To see how smart the child is. Those are all more from an internal cognitive perspective. But what make a person later on grow up to be successful, to be a successful profession, there are some other aspects. If you look at here, the culture the person is in, and then the social interaction means, let's say now, right, we're using medical as an example. In the medical team or the nursing team, when we have students coming into the hospital, how well does the student mingle, interact with the whole team? That makes a huge difference. So that's an example, so-called social interaction. And then the language, the language we know, we all speak English or our own mother tongue, right? Like I speak Mandarin. But when we're talking about the professional field, do you know how to carry the conversation? Like when you talk to the patients, when you talk to the senior, when you make a professional presentation, there are certain norms we have to comply with. So that's overall, when we talk about socio-cultural theory, these are the aspects you want to look into, okay? So to be specific, this study use the specific theory under the socio-cultural theory is called figured worlds. So what exactly this mean? I mean, it's coming from the, anthropology, social science. So that's why I think many of the terminology here may be quite, you may feel quite strange, but then when I explain it, you will feel like, oh, this is actually like a common sense, right? So this theory has been widely used in social science when people talk about identity formation. So remember, identity is very important. It's not just for educators. In many other fields, right? For example, like we talk about organization, Sim Health, or SGH, CGH, you know, actually the corporates, they are doing this secretly too, try to make us like feel loyal to the organization. Actually, they are trying to build our identity as one of the employees for the organization. Okay, so anyway, so this theory has been widely used to explain, you know, what can be done to help someone to develop the identity. So that's why they use the terminology figured worlds. What exactly, I mean, so the figured worlds, I will show you the example here, okay? So this came from another study in general education. They talk about, you know, to become a science educator, what are important to help someone become a science educator. So the left side of the figured worlds, you see these are the examples, how the person was brought up, the childhood, the family environment, the school the person went through, and out of school activities, higher education, the professional experience, and then science, the field itself. I mean, actually, I mean, if we look into healthcare, similar, anyone here today as the healthcare professional, we all went through similar, we call figured world, right? We went through similar, I mean, your childhood, all these key components are actually similar, the category, but also it's different on the individual level. And then on the right side, you see actually all these terminologies when we talk about identity. These basically are the key components to show who we are. But then the both sides actually is dynamic, it's keep changing, evolving, right? Like let's see, like, you know, for all of us here today working for Sim Health, right? I'm sure going through COVID, you know, it's a major event. So later on, when we reflect on us, you know, what made us here today, we will see like, oh, went through the COVID, you know, that was a major milestone, affect me to become a, you know, the nurse. How am I today? Okay, so this is quite dry here, but anyway, so just want you to remember when we talk about this type of research, it is very important to have the theoretical framework here. So actually the main components here, that's how they guide the team of the investigators frame their research questions and then went ahead to collect the data. Okay, so that's enough about the theory part. So here just, you know, come back to you all, I share quite a bit. So we talk about the culture, right, the environment. So let's, I mean, at least a couple of you share, you know, what's the teaching culture in your own context. It can be like in the hospital you are in the department, in the world you are in. Can someone share? Thanks, Deanna, for sharing. I mean, Journal Club, one is we want to learn more things, right? About the field, about healthcare education. On the other hand, actually, if it's a research study, you want to learn how they do this, and later on, in case you conduct your own study, okay? So, okay, so Deanna talk about the teaching culture, right? She's like, can be pro or not pro teaching, can share why and why not. Yeah, okay, so I will just randomly, okay, Christina, are you there? Can you share introduce yourself, which institution you are in, what department, what's the teaching culture like for you? Okay, you can type there too. Christina's quite shy. Let's see. How about Be True? Are you there? Be True? Sorry, did I see your name correctly? Come on, guys. Like what we have been talking about this quite often. It's a journal club, you know. It means like we sit together, you know, have a cup of coffee and then talk about the study. It shouldn't be like a presentation. So maybe, okay, Deanna, you can share the teaching culture at General Medicine Department at St. Conlon. Maybe can you share with everyone?
Oh, Be True is with a patient. Thank you, thank you.
Oh, okay.
Okay, yeah, I can share. So I think for Sengkang, rather than I'm not the receiver of the culture, right? I'm trying to create the culture of teaching. So yeah, we try to create this co-teaching culture. I think firstly is, I think I'm quite grateful that the people working in Sengkang, they are quite pro education, like because we have clinical service as our main bulk, right? So we also have a lot of students around. So they are our faculty also highly encouraged by the presence of the students, and then like teach them and things like that. And then because of that, the students are so very grateful. So I guess it's like a positive feedback, right? So if you're good to the students good for you, then it just reinforce your professional identity lah. So we do try to make it more teaching friendly, like more inviting to the students. You make sure that you acknowledge their presence. We listen to them. We try to really listen to them. And of course, you know, nowadays you will complain that, you know, students are a bit more whiny, right? So at the same time, you know, like being a parent also, right? So we also reason up to them, like, of course, some things we can improve, but there are things also that they also should accept and grow lor. So have to just really communicate and have that constant communication and to be present with them. And of course, you know, Chaoyan heads a very like wonderful EDO team. So, you know, the other success for a good education is also the administrating team lah, like, you know, the logistics, the facilities, good IT support and all that. So yeah, so thank you Chaoyan also for leading such a beautiful team. Yeah, which helped. So I think that's for Sengkang. You can share in your own hospitals how is it? Yeah, thank you.
Yeah. Well, okay, if we have a very quiet team today. So, but anyway, don't worry, but just, you know, hopefully you can think about it, you know, what's a culture, since we're talking about clinical education. So that's why with the question here, when we talk about culture, we're talking about teaching culture. I mean, of course, when we talk about professional identity, it also can be, you know, you use the concept to explain, to help yourself to see like how to, you know, get someone to become the best in the profession you are in, like you know, best medical social worker or the best OT nurse, things like that too. And then so you reflect on what's a culture, you know, in your own department. Okay, so okay, we'll just keep going. So Deanna, can you explain the methods? Yeah.
So the methods for this study is, you know, because some qualitative study is a lot of interviews, right? So this one is interesting, whereby, so the authors actually embed themselves in the context, like they join ward rounds, they join the they have journal clubs as well, things like that. So the authors actually embed themselves inside there, and they document field notes. So this is something called ethnographic study, whereby the authors embed or immerse themselves in the context lah. So this is another type of qualitative study. So if you want to know more about qualitative studies, just to self-coyo, right? So AMEI also have their in-house qualitative studies, which you can join their workshop. And of course in Sengkang also, we are going to run a qualitative workshop soon in September. So if you are Sengkang or what, you can also email us, right? If you want to join our qualitative study, to learn more about qualitative study. So, but ethnographic study is one type of qualitative study. So other than the field notes, right? So they also have participants interview. So we have this data triangulation lah, and also video recordings as well. So this study is also guided by the conceptual theory that was described by Chaoyan in great detail. right? So they want to identify how teachers and postgraduate learners establish and maintain their professional identities in the surgical and internal medicine world. And they choose these two different surgery and medicine because of the culture, right? So the medical culture is a bit different, and the surgical culture is also different. So that's why the authors embedded themselves and interview the participants there, so that they can actually extract, the actual culture which forms their identity. Yeah. So next one, I think we have Hui Lon say something that KKH is very pro teaching. Yeah, they are very willing to teach and all that. So yeah, I hope that you can also spread this culture in SingHealth lah. Okay, then the next slide, we also talk about the data analysis. So how they analyze the data. So when the authors actually take the few notes, right, they see a few components that's happening. Like firstly, what are the meaningful acts? What are the figurative things that they wanted? What are the artifacts and the figured language? So these are all like the words there and how they actually justify it lah, right? Using the conceptual framework earlier on, they embed it and they use it as to collect data, right, in these components. So like, for example, I won't go through all this, you can read in the paper lah, that meaningful acts. So what does it mean by meaningful acts? That means when the authors will take note of any self-evident behaviors during the rituals or event. For example, like during the case presentation, walk rounds, case conferences. So another example is like figures. What do you mean by figures? So the main figures is like when the person fulfills that role, perhaps like the educator role, right? So for example, they say that like teachers as coach, teachers as model, and then like the learner. So one focusing on the teacher, one focusing on the learner lah. Okay, so then after that, they collected all this data in their field and then they analyze using all these components. Okay, so I think Chaoyan is going to share about the results later on. Yeah.
So Deanna shared how the data was analyzed. Again, so if any of you are interested in doing a qualitative study, the way how the article was written up, this perfect example you can look through. Okay, so coming to the results part, Deanna shared already, right? Remember the figure, the words, the 4 components. So again, you see the alignment, right? From a theoretical framework to the data analysis and to the presentation of the results. Okay, so the first part here is talk about core artifacts and practices. So again, don't worry too much about this terminology, what artifacts this refer to. But anyway, the authors, they explain here, artifacts in surgery, it's more often, when the consultants and then the students, residents, they talk about like the patient's body parts. That's more prominent. But in internal medicine, the emphasis more is on patients' clinical records and then the clinical presentations. But you always can argue actually both are important regardless of which professions you are, which specialty you are in. But again, based on the data, what they are sharing here is which one is more prominent, more obvious. So that's what you see here. Okay, so under this, so that's about the artifacts. So in addition, talking about coaching, again, in healthcare profession education, we hear a lot, we're talking about coaching, supervision. These are super important. So in surgery, when it comes to the coaching, it's more, the discussion on the patient's body again, and then it's more like an apprenticeship. So we explain later on a little bit more, but we don't want to spend too much time to go in the details of the results here. But for IM, very often the consultants tend to, do the role modeling and then let the students go for the self-directed learning. Okay, so the learning culture is also related. You see some of the overlapping results here. The learning culture in surgical is more confrontational. So like the surgeons observe the trainees more closely and then scrutinize their practice. But in IM, it's more like, the consultants, they will think out loud to explain the reasoning, clinical reasoning process, and then hopefully, and then the students, consultants, they can learn, and then they can reproduce this. So again, some of you, you're sitting there, you may see like, you know, it's now someone may come from surgery or AMC. That's not exactly how they like for my profession. But just want to let you know, for qualitative study, they are showing what's the situation like in their own context. So the study, the data collection was from the two clinical wards, I think from Ireland, if I remember correctly. You know, the Western culture, maybe the dominant culture may be different from us in Asia, okay? Just bear that in mind. Okay, so Deanna, you will share the second part of the results.
Yeah, so the second part of the results, right? So they describe further in terms of the cultural world of surgery versus IM. Yeah, I know we have a lot of nursing and as well as allied health here, but not to worry, some of them also can be related and some can be different. So that's why we also want to ask you all later on as we go through this to also contextualize and to also reflect on your own cultural context, and then we can have a short discussion later on. So they divide into a few things. Number one is the knowing part, which I will describe soon, just to give you a brief overview. And then next is actually the seeing and talking and prudence, resilience, and self-directedness. So these are the components they talk about. So we just go back to the previous slide, right? So what they talk about knowing in surgery. So knowing is to surgery, right? The culture is the knowledge is founded on very anatomical and pathophysiological principles, right? So for IM is more of the qualitative kind of reasoning, right? And then whereas surgeon is, I think they describe it as a little bit more black and white lah. So then this knowing, right, is helps them to define that why they practice in such a way. So for example, you know, I can say that in surgery, right, they always say, oh, if no medical issue, no surgical issue, admit medical. So that's a little bit like in context like that. Right. And then this knowing also helps them to act in situation where they don't have, so they're a bit like trying to say that they are a bit type A, right? So that they can act in a very urgent or in crisis. So they are very able to fight or flight. So their response to that is very good. So compared to IM, so IM more analytical. They like to summarize complex case presentation, a lot of reasoning, and then a lot of decision making, right? So then the consistency of the patient is judged by consistency, logic, and alignment with evidence. So that's the IM culture in terms of the knowledge part. Then the next part is the seeing. So seeing is again, surgeon more objective, or black or white, right? So then they talk about the surgical procedures as well. So is the margins clear or not clear, right? And the functional outcomes. So in terms of IM, so we want to also like provide the clear-sightedness of a holistic, you know, focus more on a holistic care, and also more focus on taking history and also investigation details. So progress of patients, so different culture. Then in terms of talking, right? So surgeons really more straightforward like what they say, right? They also use the hero, disaster deliverance, right? And actually make themselves very capable. So they are very straightforward, right? Compared to physicians. So physicians a little bit more like Yoda they say, right? So a little bit more logical, there's reasoning, right? And abstract, right? Yeah, so the thinking is a bit different. Sorry, even the talking, right? Yeah, so they have the compelling abstract models. Then in terms of prudence, right? So surgeons, they a bit high stakes, right? So they navigate tensions between caution and action. So that means when to operate, when not to operate, right? So for IM, we are more reflective. We see how things go, right? How our patients progress day to day. And then we look for new data, and then perhaps we reflect again and refine our teaching. So not teaching, but management. So it's more iterative, right? So whereas surgeon is, wow, you have to make the decision there on that job or not job already, right? So in terms of resilience and self-directedness, so resilience is a highly valued culture in surgical team because, they work in such a high pressure kind of society. I mean, like it's their job because, patients without surgery is really, sometimes they can really die, right? And of course, they're also worried because whatever they do, will affect the outcome of the patient. For example, surgical complications. So they really need to be resilient, and their reputation is very important. So their coaching rise, right, is really on intervention, right? So always they are quite critical about how you operate your skills. Whereas for medicine, right, so you need to again reflect a lot, be more self-directed lah, and in more of mentoring, right? Rather than surgeons coaching, because coaching you teach a skill. So this one is more mentoring, more like inspiring, right? Yeah, so that's the resilient part. And then the last part, Chaoyan will share.
Okay, thanks, Deanna. So remember, right? There were 4 categories for the results based on the theory. So the last 2 parts here, basically, it's for the formal education events during the training versus informal. Informal means those bedside teaching. You have a patient, you think it's interesting, you bring the students, say, come see, what's going on. Okay. So for the formal teaching, the surgical rounds versus medical rounds, I mean, it's surgical definitely, needs the person more assertive, more confident when doing the presentation. And then the surgeons, the consultants, they may just throw the question to the presenters on the spot. But medical side overall, the emphasis is using the most structured format. And then the senior, senior consultants, they are more in a more mild, more gentle manner. And then, so give the presenters less pressure. For the informal way, surgical side more, what I see, bedside or learning in the theater, but the medical more case presentation, because we don't have that much time, we don't want you go in. We have been throwing in a lot of details already, but some of you may wonder what's the point, for us sitting here spending my precious lunch time to know how different a surgeon versus an gen med doctor consultant, So we are not putting too much time there anymore. So here just a quick summary of the the study. Basically the results, each specialty, right? Surgical versus IM, or OT nurse versus the EM nurse, or physio versus MSW. All these, your own profession, you have your way, you decide what to teach the trainees and then how to teach. Similarly, they learn the way, they learn how to learn, what's the best way to learn all these skills and knowledge along the way, okay? So they're all different. So the second point here, we talk about identity. Identity, each specialty, they have their own unique way of learning, seeing, talking, and being. So it's through the discussion, through a lot of interaction between the trainee and then the educator. And then into the day, I mean, it's ongoing, right? Healthcare, we talk about so much continuing professional development. Actually, the identity formation is ongoing, okay? And then the last point is, it's shaped by many key events. Like say, when students come into the hospital, they are embedded in a team, and also the alignment or misalignment, how you make adjustments. If the students, their value, the practice, the way of doing things is different from the norm in the specialty, and then the students have to make adjustments for the alignment. Okay, so these are basically the key summary points here. So like what we mentioned about, we talk so much about surgery and IM, but we want to bring this to your own context. But what do you think about these findings, especially in your own context? Do you agree or disagree? Can you guys please share? We have like a last actually 10 minutes now. Deanna and I have been talking a lot. I want to hear from the rest of you. Yeah.
Yeah, perhaps from the nursing side can add on lah. Yeah, the culture.
How about Carrie again? I can tell Carrie is from nursing side.
Thank you, Carrie. Thank you.
Oh, Huiran. Surayami also is from nursing. I just can tell by the, the professional number. Yeah, can you all please share? Otherwise, it's quite boring. What's the point? You're your lunchtime here hear us talking about professional identity. So do you all, what does it mean? Again, now after almost 1 hour, what does the professional identity mean to you now? Do you have a How about Eileen?
Hi.
Thank you.
So I guess what you mentioned earlier, I agree to a certain extent. So I was just reflecting inside as I was hearing you. And then I thought, because of my training all these years as an OT nurse, that actually shaped how I actually do my education. So pretty much like how the surgeons would do it. Controlling. So people often ask me like, can't you be a little bit more relaxed and let your students explore a little bit more and let them just, explore. Why are you so controlling? So now I guess this really answers to the question that I've been trying to figure out. And also that my parents are teachers and my dad is rather a controlling person. So perhaps that also shaped who I am today in how I look at things. Very much influenced by my parents and then also the experiences that I had in the operating room.
Yeah, thank you so much. Yeah, sorry, you were saying, but
yeah, so thanks so much for sharing. Then today I realized who I am.
Thank you so much. I think what you share is also very enlightening. It's true lah. Actually, there are many facets of professional identity. So if you're interested, you do look up into more works, especially by Yvonne Steinert. She has a very nice algorithm, right, about what actually forms identity. So yeah, it's true. Our upbringing, who we are, where we are, right, is very important. So it's quite interesting to also know the second point is that the nurses also do follow like the main people that they are working with, which is like whether they are in the surgical ward or like in the OT or is it a medical ward, right? So that's quite interesting for us. So I think for us as medical persons, then the more we need to be reflective, of who we are, because we not only affect like the medical team, right, but also the nurses as well as the whole ward lah. But thank you for that. Anyone else want to share?
Okay, while the rest is thinking, can I ask a question to Deanna and also everyone being here? To be honest, I spent quite a bit of time trying to go through, this article because we have to moderate. But then until now, at this point, I'm just still thinking, how does the results will this? How's this going to affect, the day-to-day work, especially for many of you on the clinical side doing clinical teaching? To be honest, I don't have an answer. I want to ask you all. I think this article didn't help me achieve that level to address my question. What do you think, Deanna?
Sorry, can you repeat your question again?
Does this, with reading the article, the results, is this going to affect you, how you do your day-to-day, your clinical teaching? And yourself being a clinical educator.
Yeah, so like I say earlier on, right? Like what I think Eileen brought up, right? So the way that we act, right, not only affects our team but everyone else. So I think reading this article does give me this realization, like it's like a mirror, staring to you. Like physicians are such, surgeons are such, right? So like then you know who you are, and you have to next find out like how does this culture help or don't help your clinical teaching, right? So that will be the next part of the study where you have to interview, I think, the learners, right? So their needs, and slowly, hopefully, you can tailor that to them I think in terms of physician, I mean, I do agree with what they say. It's true, and I think that it doesn't really like prevent or like deters the teaching, because it expects thinking and all that. Yeah.
Right.
That's for me. Yeah. So I think the next part is really to ask the learners. Yeah.
Thanks for sharing. Okay, I think we don't have much time. I'll just I think we still have one or two slides. So Deanna, you want to share here?
Yeah, so I think ultimately we want all this to translate to develop the faculty, right? Like what Chaoyan say, right? How does this help us, right, as educators? So firstly, number one is to reflect, is this true? Is this not? And in our context, how is it? And what can we improve? So that's why like when they have this, right, they wanted to also improve the faculty development. So they suggested actually the clinical teachers were to observe and to understand the workplace so that we can change our culture accordingly. And then the next thing is so that curriculum can be developed, right, relevant to the politics. So by knowing like how the surgeons act or how the IM people act, right, so you can sell or pitch your faculty development ideas to them, right, and contextualize to their learning place. Like for example, IM learning is more about case presentation, bedside teaching, ward round. Again, a lot of case presentation. Then your teaching should be tailored according to that, right? And whereas for surgery, they need a lot of surgical skills and all that. So then your teaching and culture should be tailored more towards that. And most importantly, also now they want to encourage, right, use of technology, right, to also collaborate with the clinical context to understand the workplace, so that we can also solve the educational problems. So I'm also really not sure that how we can have this VRE in a context. I don't know, maybe a virtual walk around for I think for physicians. Yeah. So that's what we did also, right? During COVID time, we translate the bedside because students couldn't come to us during COVID. So they have this virtual walk around thing. Yeah. So I think for the surgeons as well. So I think the next one is also a question. So yeah, again, asking your thoughts, but I guess we are running out of time, I suppose. So anyway, if we just open up for any questions that you need to clarify, or like any last reflections that you all learned, because Journal Club also not for us to share, right? But we also want to learn from you all. Yeah.
Yeah, it would be wonderful. We all can meet face to face and have a cup of coffee and then talk about the article. If no, I think we are, it's almost 2 p.m. It's everyone sure have a busy Friday afternoon to wrap up the work. Let's just end the session now. We thank everyone being here with us today. Hope you find it, the articles interesting, learn something from this.
Yeah. Okay. If not, then thank you. Yeah, if you have any questions, as our email as well, right?
Yeah.
And thank you.
With us, want to continue the discussion, even thinking about maybe a study on this area. Yeah.
And join our workshop.
Thanks, everyone.
Thank you. Bye-bye. Thanks.